Magandang umaga sa lahat. Good morning, everyone. Let me just check if we have our speakers on, Zach, and our moderator, Zach.
Hello,
are you there?
good morning.
Good morning, men and married, Vic.
Yes, can you hear me? Yeah, hi.
Good morning, Zach. Men and married, Vic, too.
Morning.
Good morning, men. Good morning, married, Vic.
Good morning.
Good morning. And our reactors, good morning, Daryl.
Gandang umaga. Good morning.
Magandang umaga, Dick.
Magandang umaga rin.
Magandang umaga. So nandito na tayong lahat, maaari na tayong magsimula. Magandang umaga sa lahat. Thank you for coming on and spending the morning with us. We have quite a few participants across the country we see and also outside Manila actually. So magandang umaga o magandang gabi sa inyo. We are speaking to you mainly, we are all in Quezon City except for Zach who's in Makati, but all in the NCR, which is now going into almost our 6th month, some form or another of a community quarantine or lockdown. So 6 months into this pandemic, we thought it was a good opportunity to gather us, our speakers, our reactors, and everyone who's here to listen to each other, reflect on what this has meant for the country and also for our work. So ang objective mainly for this morning is really to listen to the thoughts and insights of our speakers and our reactors, and hopefully for us to come away from this morning also with reflections of our own, specifically on how we should be conducting our programs, our advocacies at this time. At siguro pag-isipan na rin natin dahil this looks like a really long-term or at least a medium-term situation that we are confronting. Paano pa tayo kailangan nag-a-adjust ng ating mga trabaho at ng ating mga gawain at advokasya. So yan ang napaka-simple naming layunin para sa umaga ito at sana ay sama-sama nating mabigyan talaga ng panahon at pag-iisip ang ating mga programa sa panahon ng pandemya at sa mga darating pang buwan. So we're very fortunate to have our speakers with us this morning. I will leave it to Zach to do the introductions. And I'm very happy that we have a moderator who will be, in whose hands we will have, I'm sure, a very good discussion. This is Zach Luzon. Magandang umaga ulit, Zach. Zach is the co-coordinator and also on the secretariat team of the COVID-19 Action Network, which is a coalition of civil society organizations engaging with the government for a more effective, systematic, responsive COVID-19 response. Zach was also with the INGO Teach Philippines and also was an editor with Rattler. Thank you, Zach, for spending this Friday morning with us. We're in very able hands, as I said. So over to you, Zach.
Thank you a lot. Just a quick correction, Teach for All. Teach for the Philippines is a partner of Teach for All. But thank you very much for that intro. And of course, thank you for inviting me to moderate this forum. I think this is very timely considering we've been under lockdown for how many months? I mean, more than maybe 6 months already. And of course, we're entering the final half of the, or we've entered the final half of the year, the final quarter of the year. And so it's good to always reflect and think about what needs to be done. Sabi mo nga, Lot, it's at least a medium-term problem. So really, this is a marathon. And, we're nowhere near the end at this point. So I think we're all here to also learn from each other and listen. And I'd like to encourage everyone here to really raise your questions or just give your comments. Use the chat box because we want to make sure that everyone can be heard. If we all unmute you, baka maguluhan tayo. So we'd like to encourage everyone to use the chat box, type in your questions and comments, and later on, we'll be taking down notes and answering or asking our speakers to answer some of your questions, or even type directly in the chat box if they have an answer. So I'd like to also inform everyone that we're also live on Facebook sa Oxfam sa Pilipinas Facebook page and other Facebook pages of our partners. So please do share that. For those who can't join our Zoom call today, you can watch us on Facebook. And we're going to have a very good discussion today about two main speakers and two reactors. And I'm sure a lot of you have some words to say as well from our audience. No? So let's get started. Our first speaker, of course, someone very dear to me, a friend, Men Santa Ana, is the coordinator of Action for Economic Reforms, or AER, which he helped establish in 1996 with Oxfam's support. And since then, AER, which celebrates its 25th anniversary next year, congratulations, has been at the forefront of the most difficult economic and development reforms in the country. So Men today will talk about those challenges and what needs to be done. I'll turn it over to Men, who, by the way, is not on camera because he's having some technical concerns on our end and we don't want to stress him out. So let's enjoy the picture of Men. And Men, go ahead.
Maraming salamat, Sak. I'm very sorry. I do not know how to turn on the video function of Zoom. And yeah, what is more important is the message, not the messenger. So my presentation is about the Philippine economy and COVID. I will cover the current situation, what the strategies and problems are, what the future would look like, what we want to be a better new normal, and as a last word, let us re-examine the development model or the dominant paradigm that we have now. Okay, regarding the economic situation, let's start with the situation before COVID. So from 2012 to 2020, we have had sustained GDP growth averaging about 6.5. That's quite impressive. At the same time, our poverty incidence has been significantly reduced. Latest data from PSA would show that the poverty incidence among population has dropped to 16.7%, which is a drop of about 7 percentage points from the 2015 figure. So from 23.3 in 2015 down to 16.7. Again, that's quite impressive. It is established, undeniable, that is, that we do have strong economic fundamentals, and this is anchored on some very crucial reforms undertaken in the past years. In particular, the series of tax reform measures that I would say started in 2012, the sin tax reform in 2012, and that created the momentum for further tax reforms in 2017, 2018. Then you have the rice tariffication, which might be controversial which is controversial, but we can establish that in the long term and even in the short term, it has resulted in improved welfare for the people. So yun ang situation before COVID, and the strong economic fundamentals can also be manifested in our credit rating. Government, in fact, has been targeting an A grade in credit rating. The Economist has likewise ranked the Philippines among the top emerging economies with a high level of financial strength. We ranked 6 among 66 countries, and these countries include Korea, Taiwan, and others that in fact have reached advanced status in terms of economic development. But then COVID happened, and so the economic downturn is inevitable. In fact, it has been a policy choice to downgrade the economy. There is no other way. The lockdown, of course, would result in an economic downturn. But even if there is a lockdown, some would argue, the libertarians, for example, would argue that the lockdown resulted in tremendous economic cost. But even without a lockdown, we would still have suffered there's no way that the economy could have grown in a situation where people fear the pandemic. Okay. And of course, we all know that there's been a rise in joblessness and hunger. I don't have to cite the statistics there. And now that we are slowly opening up, we can expect the economy to grow, but still in a situation where we have a recession. The lockdown, for example, resulted in the closure of almost 80% of the economy. But this is a problem. Even if we have strong economic fundamentals, and even if the economy is now opening up, there is full of uncertainty. COVID-19 is about uncertainty, and how this pandemic will unfold will define the economic outcomes. Wala tayong magagawa doon. No? COVID it's called a novel coronavirus. Being novel means that we really don't know what it is. So we just have to accept that as a constraint. And so for some time, we will have a situation where mobility and economic activities are restricted. And of course, this pandemic will have lingering effects for the long term. We have friends who we call as long haulers. In other words, the effect of COVID is not only in the short term, but those who got sick because of COVID are affected even for the long term. So that is an example of the long-term effect of COVID on people. Another aspect about uncertainty is not just COVID, but the 2022 elections. We cannot discount the possibility, even though it might look slight, that there might be no elections. That's very worrisome. And even the election itself would create uncertainty. We want credible, clean elections. Next year, of course, will be the start of the campaign. And that will create more anxiety, more uncertainty. Okay. And given all that, the uncertainty that envelopes us, it's iffy that we will be able to recover at the soonest. The government is hoping for a V-shaped recovery. Everyone wants a V-shaped recovery. V-shaped means a quick recovery, parang yung V, diba? There's a sharp decline, but will be immediately followed by a sharp increase. But that probably won't happen given the uncertainty that we face. And despite the fundamentals, the good fundamentals that the economy has. Now, on uncertainty, let's consider the vaccine. I know that Oxfam and LOT are involved in an advocacy for vaccine for everyone, vaccine for all. But the introduction of a vaccine also has problems. We have to face the challenges as the vaccine arrives. First of all, we do not know the efficacy of the first generation vaccine. We do not know what the unintended consequence will be. Then, especially in the Philippine context, we do know that a significant number of people now have a fear of vaccine because of the negative experience in the past, the Dengvaxia debacle, for example. Then you have some people whose religious beliefs, fundamentalist beliefs, make them fearful of the use of vaccine. So that creates a problem. And then there is the problem of the whole logistics, the political economy in rolling out the vaccine. So let us not, while this is very, very important in containing COVID, do not consider this as some kind of a silver bullet or a panacea to containing COVID. Now, where am I? Got lost. Okay. So the implication here is, even if we do have that vaccine, we have to coexist with the virus. Let's face it, we cannot just annihilate the virus. If this is a war, annihilation is not the appropriate strategy. We cannot rely on having herd immunity. Look at what happened to Sweden. The outcome is also negative. And we cannot rely either on a strategy of general lockdown. It is very contextual, and over time, the benefits from our lockdown also diminish. Regarding strategies, we all know the problems we faced in the past months. That's why the doctors called for a timeout. What we know, everyone agrees, government, civil society, the people, they all agree that our priority is health, that we have to save lives, strengthen the health system, improve the interventions, both medical and non-medical, to flatten the curve. But it encountered some problems leading to that timeout that the doctors got. This is very important that to stress that the flattening of the curve, wherein health interventions together with the provision of social protection and social amelioration would be the key to economic recovery. Economic recovery cannot happen without first flattening the curve. And there is no trade-off between health and economic outcomes. When we respond to meet the health objectives, when we provide the subsidies and safety nets for the people, all this will define and shape the economic recovery. But how do we move forward, given that resources have plunged, given that expenditures have also increased? That's where the deficit spending becomes relevant. And the government is doing deficit spending. All governments are involved now in deficit spending. But the question in the Philippines is the deficit spending that we are doing, is it bold enough? Based on government data, deficit spending for 2020 is equivalent to 9.6% of GDP. And the deficit spending will continue in 2021 and 2022. However, some still argue that this is conservative. If we compare government deficit spending, Philippine deficit spending, to the deficit spending of other emerging markets, and here I refer to the IMF's World Economic Outlook, our deficit spending is comparatively lower to the deficit spending of other emerging markets, especially those in Asia. At the same time, there is much room for deficit spending because we do have sustainable debt. Our debt ratios are very sound. That's why we have a good credit rating. So we should not worry about deficit spending. But there is also a legal constraint to deficit spending. Some might not have realized this. One particular reason why government could not spend more, even if it wanted to, is a provision in the Constitution that in case of special appropriations, the revenue to finance the new program could only come from current savings or from current resources or from the generation of new revenue or new taxes. That excludes borrowing. So that is a legal constraint that our government faces. By the way, even in relation to monetary policy, Bangko Sentral also places some legal constraint. The BSP charter, for example, restricts the use of monetization. The BSP has engaged in some kind of a printing of money or monetization, but again, the charter says that it can only be done under special and stringent conditions. So there are legal constraints. One more important thing to consider regarding deficit spending is that we also have to preserve our bullets. As I said earlier, there's a lot of uncertainty. And so even as we have to spend, and we have to spend boldly, we also have to have enough resources to meet the uncertainty. For example, new waves of infection. And in this context, the quality of spending matters. So it's not just the size or the level of the deficit. Equally important, and perhaps even more important than the size, is the quality of spending. The Arise bill in Congress is a good example of a huge amount of deficit spending, but we did study it, and I don't have to go into the details, but a lot of the resources there will be wasteful. Insertions of parallel, redundant expenditures. There is, for example, spending for questionable items like rapid antibody tests. So this strengthens our point that it's not the size of the deficit. We also have to vet the spending involved in the deficit. So let's go to the main issues. I don't have to elaborate on this, but it's worth enumerating these challenges that we face. First is COVID has been highly politicized. We know, for example, the political conflict, the political vendetta as manifested by the closure of ABS-CBN, the partisanship. And the lesson here is that as much as possible, well, the key to the success of containing COVID is to have collective action. And so when there's a lot of polarization, when there's a lot of political conflict, the objective of containing COVID is severely hampered. Then there is the problem of poor communication strategy, the spread of fake news. Even the executive is guilty of spreading fake news. We have problems of coordination failure and unclear accountabilities. You have so many chars, a lot of kingdoms, local kingdoms, LGUs even vetting national protocol, the executive itself contradicting one another. And because of that, there is also policy incoherence. A good example of this, I mentioned a while ago, the indiscriminate use of rapid antibody tests, despite the strong position of the doctors and the DOH that antibody tests would not be the appropriate tool for diagnostics. And then you have that punitive approach undertaken by a government. Despite these problems, we nevertheless see some gains. There is an advocacy done by different coalitions. And everyone knows that we should turn this crisis into an opportunity. As Winston Churchill said, never waste a crisis. And here I cite several reforms that are being advanced during the time of COVID. UHC has been accelerated, particularly primary health care. Public transport reforms are being put in place. We see a fast tracking of interconnectivity reforms, not yet done, but we are on the way there. Then the tax reform agenda is still alive. Right now, the rationalization of fiscal incentives is on the table, and it's a priority bill. The national ID, the digital ID is going to be rolled out despite a delay before COVID. And even on food security, on food productivity, there are some gains. The latest figure from DA would show that there has been an increase in the output of palay. And we hope that from these reforms, we create opportunity to advance the reforms. We can shape a better new normal. And what are the contours of a better new normal? UHC, primary health care, urban renewal, better public transport, socialized housing, green spaces, and on internet, deeper internet penetration, access for all to internet, new workplace standards and arrangements, and new models for education, new ways of teaching and learning, and redefining food security. It's no longer about trade protection, but food security that upholds affordability, that promotes competitiveness, and leads to higher incomes for our farmers. We also need to strengthen the capacity of local governments. AER, for example, has a new program on data-driven strategy. We think the data-driven framework and strategy would be the way to go, not only for national government, but for local governments as well. And all these reforms do address inequality. These reforms, some of them are transformative, some of them are incremental, but they all lead to reducing inequality. There will be tough decisions, however, for both the medium term and long term. We are doing deficit spending right now as part of the stimulus, but that stimulus has to be unwound in the future once things normalize and once we move to a new situation. We have to address the deficit, and that will lead to tighter public spending. We have to narrow the deficit, and that will likewise lead to the need for new revenues or even new taxes. It is very critical to put in place these reforms because that phenomenon of the black swan has become common, and it has become quite frequent. Shocks, crises have become frequent, and hence our response should combine both conservative and radical actions. And that suggests that the economic policies should no longer follow the conventional way. We should embrace economic heterodoxy. Okay, so the last word about COVID-19. I can definitely say that it's all over for neoliberalism. Of course, this has been said even before, but COVID-19 has shown that even the most conservative governments or even the most neoliberal governments have embraced new policies that contradict the sacred principles of neoliberalism. Best example is the deficit spending. The famous quotation here is "We are all Keynesians now." In 1971, Nixon was proud of being called a Keynesian, even though he was an extreme conservative. But at that time, the deficit that he created was only 2% of GDP. And now US GDP is equivalent to 16%. In the Philippines, as I said, the deficit is just below 10%, just below 10%. In normal times, that would scare the economists. A second feature of the post-neoliberal order is that it's the embrace of a new model. Before, this I get from Javier Solana from Spain. Before, we have this just-in-time model, which is, of course, very efficient. But COVID has shown that we just cannot rely on just-in-time. We have to consider the possibility of an emergency arising at any moment. So just-in-time giving way to just-in-case. And the example here of a just-in-case model is having an army. An army, if you look at it on the surface, might seem to be costly. Why maintain an army when at peacetime? And most of the time we have peace. So that's a lot of resources wasted. But we know that having a national army or external defense is a public good. And therefore maintaining a large force, even during peacetime, is necessary. That's an example of just in case. And we should apply, for example, to other sectors as well, especially health. And finally, and this is perhaps the most radical, even the US federal government has made a turnaround on conventional monetary policy. Monetary policy is usually about targeting inflation. That the most sacred thing to do for the central bank is to have a price stability. That also applies to our BSP. But a few weeks ago, the US Fed has come out with a policy statement saying that its priority now, or its bias, is maximum employment. And it's perhaps a matter of time that other central banks will likewise follow. So there you are. Bye-bye neoliberalism, but it's a challenge for us to shape the better new normal. Salamat.
Thank you very much, Men. I hope we have time for a few questions. No? We have at least one in the chat box, but I also have a question that maybe I should get started, because you mentioned that it's a death of neoliberalism. And yet there's still challenges. You can't just change the course of the ship quickly and turn it around or turn it in a different direction. What do you think the government, and then by extension, the whole of society, should be prioritizing when it comes to any fiscal policy reforms or any just policy reforms that we need to enact, maybe within the next 6 months or before the end of the year? Would you have any idea about that, or any thoughts on that?
Zach, the priority should be health spending and social amelioration. So yes, let's spend what is necessary. The focus will be on how we flatten the curve, and that necessarily means spending for health, for the health workforce, for the supplies, for the medicines, for the equipment. At the same time, spending or giving subsidies to those who really need the subsidies, the displaced workers and the poor.
Okay, thank you. A question from Gerwin Enerlan, actually 2 questions. Let me just read it in case you can't see it. Did the national government downplay the impact of the virus? And what did Vietnam do? If you can answer this, what did Vietnam do to be able to contain the virus? And the second question is on the liberalization. Isn't the liberalization of price control a neoliberal policy? Is it a good offshoot of neoliberal thought? So yun muna yung dalawang questions, and I'll read the other question later.
Okay, of course, Vietnam is a success story, but as I tell others, even our network, it ain't over till the fat lady sings. The pandemic is, we really don't know. You're very uncertain about that. We know that the virus is still there, so anything can happen, even for a country that has achieved success. But indeed, we can learn from Vietnam. The success stories, in fact, have a standard story. It's about testing, contact tracing, the social distancing. But what is important is the collective action. And that is something that is lacking in the Philippines. The other thing about Vietnam and some of the East Asian countries that perhaps we didn't go through is that experience of fighting pandemics in the past. So the very threat of or the experience, not just a threat, the experience of going through such a crisis in the past serve as lessons for Vietnam, Taiwan, and Korea. But the key there is collective action. That's what we have to strive for. And I mentioned a while ago that there have been problems in having good collective action in the Philippines. In relation to a price control has to be done wisely. It cannot be the main tool to stabilize prices because that can lead only to a black market. So we have to find different ways to stabilize prices without resorting to price control. A price control is what we call a command policy, and command policy works in very specific context. So I won't rule out the relevance of a price control, but one has to examine well whether it is the appropriate policy at a certain time. I'll give you an example. Right now, that there is I don't know if it's a law or an executive order regarding the price control for essential drugs. Okay, but it's not working. Even if you go to Mercury, the prices more or less remain the same. But there are other ways to lower the price of medicines. For example, government, especially now through the universal healthcare law, has a lot of power to purchase drugs. So it can use that power to influence the pricing of drugs. It can negotiate with the drug companies to lower prices.
But and just to clarify, I think you referred to rice, the rice liberalization law. So isn't that a neoliberal policy in terms of liberalizing rice control, not the prices?
When we define neoliberalism, it's about the sacredness of certain tools. Tools are elevated. Tools become principles. And that's a fundamental mistake. We have to distinguish between a tool and a principle. For example, liberalization or market-friendly policies should not be considered a principle. They are tools. So the point here is that we can use different tools. We must have a variety of tools. Our toolbox must contain different tools for us to be effective. Sometimes we use liberalization, sometimes we use control, but never elevate these tools as principles. So the lifting of the clarification, while it is associated with neoliberalism, is not actually a neoliberal policy in the context of the Philippines. In the end, what is important is how the policy, and regardless of the tool you use, will improve lives, will improve welfare of Filipinos. And rice tarification, or I'm sorry, the quantitative restriction on rice really damaged Philippine agriculture. But that's a different story altogether. But it really damaged Philippine agriculture, and therefore it had to be lifted.
Okay, yes. Okay, and then the last question before we move on is from Randy Cabases from Oxfam, Philippines. Data-driven, evidence-based policymaking, including citizen initiatives to exact accountability, would be very dependent on government responsiveness. So how would you assess national and local government responsiveness to citizen feedback at this point or at this juncture?
We are at a very, very immature level in terms of the culture of transparency, culture of data. To give you an example, despite the law, we do have a law on community-based monitoring system, but only a few LGUs have a community-based monitoring system in place. And it's also a different issue altogether how that CBMS is being used by different stakeholders. So malayo pa tayo. A lot has to be done. And that's why we want to make this a core program of the AER advocacy. And I think other civil society organizations and even reformers in government are very serious about the data-driven approach.
Okay. Thank you very much, Men. Is there anything else you'd like to add before we move on? Oh, okay. Sige. Thank you, Ben. And of course, we'll have time later on for more questions from our audience. Or if you have questions in the Facebook page, please use the comment section and we will include your questions or comments as well later on. So our next speaker is Marivic Raquiza. She is a co-convener of SocialWatch Philippines, which is a network of CSOs and POs engaging the government on its commitments to eradicate poverty, promote equality and the environment as embodied in the SDGs, and which includes financing for development. She obtained her doctorate from the City University of Hong Kong and is also an associate professor at the NCPAG in UP, where she teaches courses on social policy and developmental governance. She lived and worked with rural communities in Mindanao for a number of years when she was with the Philippine Rural Reconstruction Movement. So let's welcome Marivic Raquiza.
Good morning to everyone. I'm really happy to be here. Maybe we can start with my PowerPoint, the first page. Maybe the first page muna, please. The cover page, sorry. Cover page. Anyway, as we all know, the pandemic caught us all by surprise. And since then, we have had to learn and to cope and survive for ourselves, our families, and our communities. But as Men earlier said, a crisis also presents opportunities for us to not just to learn, particularly for this crisis, to soul search and to find out more about ourselves and about our society, about our fears, about what matters most, about what we should be doing and spending more on, and what we should be doing less. So, fora like this is good, and it's really a welcome respite because it allows us to collectively breathe, reflect, and reimagine how we want to rebuild our lives based on principles and values that we truly cherish. My talk this morning will grapple with what it means to build back better from a longer-term perspective and reflect not so much on the immediate issues we are confronted with, but by the more systemic issues that have been laid bare and exacerbated by the pandemic. That also means that I will focus more on the framework and principles that can guide us when we make specific policy choices, especially when our government makes its choices based on what it means to be in a better place. Next. Next slide. Thank you. So as we know, it almost seems like a lifetime ago when we were celebrated as one of the fastest and most vibrant emerging economies in Asia and the world. And this was evidenced by the fact that in the last 2 decades, we had pretty decent growth rates. Next. Next. And yet, while our GDP growth rates were high, this graph will show that if we look at the income distribution of families, we will see that the majority of our people are in the lower end of this graph, which underscores how the benefits of this growth did not translate into equitable development. In fact, if you look at that section where the biggest cluster is in that income class between 8,000 pesos to 9,167 pesos monthly, that amounts to 53 to 61 pesos per person per day, which is really below even a ridiculously current low poverty line of 71 pesos. Next. Next slide. Can we have the next slide, please? Yes. Now, this is the poverty trends, and as we will see, it has been going down. By 2018, we had 16% of the population was considered poor, and translated to mean 12% in terms of families, or 3 million families. But there are a couple of things we need to note. One of which is that we are using a very low poverty threshold, which is at 71 pesos per person per day. So if you are earning 72 pesos, you are not considered poor based on our statistical methods. Also, we have noticed, and this has been pointed out by other institutions, that we have been changing our methodology. They call it refinements in estimation. Not yet. Can we still go back? Refinements in estimation, but that means that we have been changing our methodological measurements. So it's really very hard to say if poverty has been really decreasing, and if so, to what extent, if your methods keep changing. But I know that in absolute terms, napakataas pa rin. In fact, they're saying that tumataas pa rin in absolute terms, yung number of poor people in the country. I would also like to add that in 2018, just like in other previous family income and expenditure survey years, the poorest sectors continue to be farmers, fisherfolk, many of whom are women, individuals in rural areas, children in poor families. I would also like to note that for the first time in 2018, the PSA was able to generate data of poverty incidence of persons with disabilities, which stood at 14.7%. I would like to later maybe know if our friends from the persons with disability sector are here, what they have to say about the data generated, the poverty data generated on this. Also, in 2018, because this is our last data on poverty, and this was even before the pandemic, the spatial dimensions were worrying because it showed that poverty worsened in the last 3 years for more cities and provinces compared to those that improved. Furthermore, poverty in the poorest provinces also worsened, such as in Basilan, Isabela City, and Tawi-Tawi. And yet, why is it that poverty overall went down? It is because we average. We tend to average, and we know that when we average, and you have a section of very, very rich people, that pulls up the entire score, which also goes to show that this methodology that we use masks distributional inequality. So we really have to think of other ways of measuring development. Next. Can we please have the next slide? So who have benefited most from growth? Yes, can we have the next slide, please? So these are the richest people in the country. And you know, every year, nag-iiba ang number 1, number 2, number 3, but basically the same faces. Nagre-regodon lang sila sa top 10 or top 15. And if you will look at their sources of wealth, it comes mostly from real estate, construction, mall and home building operations, banking. In other words, mostly from services. Now, these individuals and their companies are linked to the growth, what they call the growth areas. And these growth areas, mostly in the service sector, is a source of their great wealth. Next. Can we have the next slide, please? Excluded are those in the agricultural sector, especially farmers and fisherfolk, and those in the informal economy, whereby one estimate comprises from 70 to 80% of the total labor force of this country. I'm referring to those in the informal sector. By this, I mean those independent, self-employed, small-scale producers and distributors of goods and services. Workers in the informal economy are for the most part not covered by the country's labor laws and regulations. And when the pandemic struck, they were really, they bore the brunt, those in the informal economy. Next. So, you know, on the one hand, we have high GDP rates even before the pandemic, prior to the pandemic, and yet significant poverty levels. So we will say that the Philippines is a development paradox. But quite frankly, it is no paradox at all if we bring in the dimension of inequality. This is one compelling reality that our country is in. And this was our situation when the pandemic struck. We are one country composed of at least two worlds, where we have one where there's a section who are enjoying a good lifestyle, affluent living, and then we have low middle income to very, very poor families who are struggling to make a living. Next. Next, please. So this is the Gini coefficient, which is a measure of income inequality within a population that ranges from 0 to 1, with 0 indicating perfect income inequality among families, or perfect income equality among families, and 1 indicating absolute income inequality. While our Gini coefficient has incrementally been improving in recent years, it stands today at 0.4267, which by international standards is still quite high and is comparable to many countries in Latin America, which are, very famous for being highly unequal. So in a sense, we are in that league, at 0.4267. Now, aside from income inequality, which is considered a kind of vertical inequality, there is another type of inequality that we can bring in, which is what is known as horizontal inequalities. And this exists among different groups within the population due to certain characteristics such as disability, age, sexual orientation and gender identity, ethnicity, and location. So both vertical and horizontal inequalities intersect, compound, and complicate the reality of oppression and exploitation of many poor and socially excluded groups in the country. Next. Next, please. So this is just a comparative graph of the Gini coefficient across many countries in the region. So we will see that the Philippines is, of course, this is a select set of countries, but it's interesting to see how mataas pa rin ang Philippines. Next, please. So, the pandemic, as I mentioned earlier, has managed to illustrate in very vivid detail what we already know, that it has laid bare the weaknesses in the system and it has exacerbated these weaknesses. And I will talk more about this when I talk about social policy. In particular, I do not pretend to exhaust the list of social policies. I will really only focus on education, health, and social protection. So I was happy to hear that Men also covered a couple of social issues. And I know that our two reactors will also highlight many of these other social dimensions. So we have a fuller discussion of social policy. Just to say that when we talk about social policy, it takes the form of social services like education, health, housing, and it also takes the form of social protection. And under social protection, nandun yung social safety nets. We have social assistance programs like Pantawid Pamilya and Kalahi Seeds. It also talks about social security, so like SSS, GSIS, PhilHealth, Pag-ibig, and it talks about labor market interventions. Basically, when we talk about social policy tends to do a number of things, and that's in the slide before this, which I think we're missing, but I'll just mention it. Basically, social policies help in the reproduction of society. So we have a lot of policies like social services, education, health, housing, but it's also supposed to protect citizens from the various vagaries of life. There can be all kinds of accidents. There can be all kinds of risks that we are confronted with. And so you have social protection cover that kicks in to help us maintain a relatively good standard of living so that we don't fall beneath what you call a social protection floor, where you're living a very deplorable kind of existence. So that's the value of social protection. Now, social policy is also geared towards promoting redistribution. That's why one can consider agrarian reform as a kind of social policy. And social policies also help provide skills and know-how to make sure that our people are able to have access to productive work. Okay, next. Now let's go to health. I'll start with health. So what I will do is I will talk about health and highlight some of the more systemic issues that have been confronting the health sector, and that has only been made worse by the pandemic. To begin with, according to a study from UP, they did a study of the health sector in a span of 25 years. And I'm also using data from the National Demographic Health Survey, as well as data from our CSOs, including in SocialWatch. We all know that we have very poor health outcomes associated with unhealthy diets, poor living conditions, and low education. No? So we talk about, these are the social determinants of health: education, housing, access to clean water. We also know that there is high out-of-pocket spending. More than the majority of our people are using their own personal resources rather than falling back on a public fund to support their health spending. We know that, for example, 6 out of 10 Filipinos die without seeing a doctor. We know that there's a very high percentage of maternal deaths, and that many of our people are dying because of preventable, treatable diseases, no? As a function of poverty also. And then we're also looking at high levels of inequalities in access to quality health care. Next slide, please. One of the things that have come out in the findings is that the passage of the local government code in 1991 led to the devolution of the public healthcare service delivery to the LGUs. And this has resulted in the fragmentation of a previously integrated network of public health facilities. Thus, the devolution, the decentralization of the the DOH, no, in 1991, in the last 25 years, findings show, has weakened the public healthcare delivery and financing system to provide better quality care for poor Filipinos. And then we also know that there is a need to care for our carers. Our health workers are among the lowest paid in the region. Filipino nurses, our medical technicians. Next. Can we have the next slide? Yeah. And then I would like here to bring in the dimension of the care economy, which basically constitutes the kind of caring that is provided to our children, especially very young children, and to older citizens, our senior citizens. And because many of the caring that happens is quite expensive or out of reach for many of our people, it often this kind of care falls on the shoulders of family members, no? Many of whom are women and girls doing unpaid or underpaid domestic work. And this has been heightened, it stands to reason, during the pandemic. So when we talk about this kind of work, we know that it is characterized by a lack of benefits and protection, very low wages, if may wage at all, and of course, exposure to physical, mental, and even sexual harm. Next. Next, please, Yan. So what are some of the recommendations that can be made in terms of health? As already mentioned, the UHC is a good starting point. Rather than postpone its implementation because of the pandemic, the Health Cluster of SocialWatch Philippines has written a position paper addressed to the IATF saying that now more than ever, we need to implement the UHC law because it provides a good foundation for fighting the pandemic and building back better. We know it is not perfect, no? But it has already the beginnings of a progressive health law. For example, it provides automatic coverage to all Filipino citizens. It provides essential health benefit packages to all Filipino citizens, which includes primary care, medicines, diagnostic, and laboratory tests. It makes sure that PhilHealth should be more effective as the national purchaser of health goods and services so that it strengthens its capacity to negotiate with healthcare providers, which in the long term can reduce the quality of services and lower health costs. Of course, we know that PhilHealth now is saddled with a lot of issues and problems, and that should be addressed, but that does not negate the importance of the UHC law. We should improve the conditions of our carers, no? Hire more health workers and provide adequate wages, hazard pay, social protection, improve their working conditions, and improve the nature and conditions of care work by recognizing, reducing, and redistributing unpaid care work. I think that we need to highlight that care work is not the responsibility only of women and girls. We need to get the men and other genders. All of us should be part of this endeavor. Next. In terms of education, next please. Next, education na tayo. Education, next. Yeah. Now, prior to the pandemic, it has been noted that there have been improvements in the completion and survival rates of students in primary and secondary levels, although many were still left behind. And here you have some of the data here in terms of out-of-school youth, how many have not completed basic education. The budget of DepEd for alternative learning system remains less than 1%. And IP education, children and youth with disabilities, we're getting very, very little support, no? Next. Next, please. And then, of course, a critical issue is quality of education. Very low quality of teaching, as shown by many achievement tests, including licensure examination tests of teachers. And then there is no national law on inclusive education, which is so important for us to operationalize Leave No One Behind. Next. Next, please. And then when the pandemic struck, this exacerbated existing inequalities. And one new dimension that came in was that the digital divide, which was already huge, became even much more pronounced because there were so many public schools, so many teachers, and so much more students who had either no access to the gadgets or had no access to the internet or very limited. No? So this is a challenge that that DepEd and many of our people are facing. Next. And so we know that dropout rates will increase. The 27 million learners in primary and secondary schools, will only, I think, 23 million now will be enrolled. And then there's also a huge dropout among the alternative learning system enrollees, as well as in the private sector. Many private schools are closing down. And many of the students in the private sector are migrating to the public sector. Next. Next, please. So some of the recommendations that have been raised is that the need really to invest much more in remote learning so that we're able to somehow substantially address the digital divide that has been made much wider. And to establish it in a way that develops more open, flexible, and inclusive and equitable education systems for the future. And here, I think we support DepEd call for, making sure that unprogrammed funds for education go to program funds, making sure that that money, I think we're talking 25 billion, will really go to funding for education. Kasi pag unprogrammed, you never know how it will eventually be used. But if we translate that into program funds and really earmark it for very clear line budget items for educational facilities, for these kinds of things, for modules and all that, then we're sure that it will go to where it should go. So we support DepEd in that. We support DepEd in hiring more teachers. At the same time, we think that much more can be done in terms of supporting, really looking for out of school and COVID-19 affected learners and finding out who have fallen out of the loop because of COVID and providing support so that they can come in at the minimum through ALS. Also providing setting up community learning centers for indigenous communities, IP communities, increasing support for conflict affected and poor Muslim children, building resource centers for learners with disabilities and strengthens their support. And we would also push for a GAD analysis of DepEd's plans, budget, and implementation, because there was a observation that the GAD perspective needs to be strengthened in DepEd. And many of these proposals I'd like to acknowledge are from the ABI proposals, Alternative Budget Initiative of SocialWatch from the education cluster. And earlier, the health proposal I was talking about came from also our health cluster, composed of various CSOs. Next, please. So social protection. Basically, the general assessment about what plagues our social protection system across decades is that our social protection system tends to be fragmented. Social security membership is quite limited. Social assistance programs are also limited, no? And then, of course, there are administrative efficiency issues in terms of targeting, in terms of delivery systems. And then these are quite clientelistic. Ang binibigyan lang or napapaboran those who have links with the LGUs and all that. It has also been seen that enforcement of social security is a problem. Many companies do not pay social security of its employees. There's a tendency to measure social protection in terms of amounts disbursed and number of workers who benefited, so beam counting, instead of looking at the more substantive, how many workers have been trained and managed to do productive work and therefore earn a good salary and have access to social protection. And then we are very much oriented towards targeting rather than universal social protection. And we need to look at the sustainability of our welfare and safety programs. Next, please. Now, if you look at the social protection in the time of COVID, when I checked the ILO data of government responses to COVID across different countries, one would note that very active then ang Philippine government in providing social protection measures compared to many other countries. Of course, that could also be a function to the level of vulnerability experienced by our country. But it's also worth noting that in a SWS survey, 72% of Filipino families said that they benefited from cash assistance, which is a relatively good number. Next. The problem is that our social protection system is very much hamstrung by this targeting mindset, which can be disastrous, especially in the context of a pandemic, where a broad swath of the population needed support. And here we were only targeting, in fact, only a percentage of each barangay, when oftentimes the entire barangay needed the support, which was precisely why during this time, SocialWatch came out with a position paper saying that we should do group universalism. You know, why don't we provide SAP to low-income barangays, to everyone, rather than pick and choose which families within that barangay? Why don't we target the poorest barangay and give everyone, because that expedites the aid that's much needed. Now is not the time to be very strict about our targeting, and also make sure that we are giving it to those who needed it, And generally, at that time, we knew that almost everyone in these poor communities would be in need. So the problem was that since we were targeting, all of the problems associated with targeting came to be, such as we were stuck with a lot of inclusion and exclusion errors. No? We were stuck with patronage politics and clientelism. Now there are so many issues against LGUs who were seen favoring their constituents over others. It also became a source of corruption. It tended to foster divisions in local communities rather than solidarity kasi nagkakaroon ng inggitan. And it stretched the administrative systems of our people kasi it's not easy to target. Targeting is a sophisticated administrative exercise. And if you have weak state capacity, targeting is, you will have really high problems with targeting. Next. Next. So basically what we are suggesting is that we need to operationalize a universal transformative social protection framework. I'd just like to add that for the first time, the language of universal and transformative social protection entered the Philippine Development Plan in 2017 and 2022. And it became even more real because in 2019, DSWD and together with other agencies and civil society helped create and identified what did we mean by this. So when we talk about universal, we talk about everyone getting incomes for all citizens. We talked about transformative because we need to talk about social structures and systemic issues. We talked about a life cycle approach and then we talked about the need for a universal social protection floor, which is now a commitment of the Philippine government because it's SDG 3.1, and it is now in in the DSWD and in the interagency body of government that we should have a universal social protection floor. Next. So what is the social protection floor? Basically, it covers all of these social security guarantees. And as we know, we are not starting naman from zero in relation to this, because the government is already implementing a number of programs like Pantawid Pamilya, we have Social Security, we have pension schemes, and we have, like, for example, the UHC. All of these are important building blocks to the SPF. These guarantees can be scaled up gradually and progressively, making sure it is coherent with national policies and reflects our economic and fiscal capacities. Next. Next, please. Yes, so what we need to do in terms of social protection is to have a comprehensive assessment of our different social protection programs, make it cohere, identify the gaps, and help fill in the gaps. And this is currently being done through an assessment-based national dialogue led by DSWD, ILO, DOLE, and NEDA, together with CSOs. And then, of course, there's a national ID system that's being discussed. We want to make sure that the national ID system help promote universal programs needed so that old age pensions, child benefits, persons with disabilities are properly identified. Next. And then let's enact the Magna Carta of workers for the informal sector. This is so important. Let's support the informal economy workers who are pushing for this, many organizations, because this will mean that many informal economy informal worker organizations can now register to LGUs or national government. By registering, they become visible and they can have access to social security, social protection. And in times of crisis and the government needs additional workers, they can be tapped. No? And then more strategically, let us prioritize a national decent work agenda, because what we want is for our people to have access to productive employment and to make sure that this kinds of work are associated with the rights that we need. Next, please. Finally, it's hard to target those who are usually left behind if they're not in our database. So let's make sure that they're in our database. Persons with disabilities, senior citizens, etc. SocialWatch sits in the subcommittee on social protection under PSA, and these are some of the things that we're looking at. Let us make sure that in many decision-making bodies like the IATF, that CSOs and people's organizations are represented, are heard. Next. And we already wrote a position paper also along this line. Next, please. So basically what I'm saying is that we need to increase social spending for areas of the care economy, areas of education, health. Why? Because it is a moral imperative, but not only that, it makes good economic sense. By giving, for example, transfers, cash or non-cash, in the hands of our people, it increases consumption and fuels the economy. Furthermore, increasing spending for education, for health, increases the productivity of our people and our capacity for innovation. So it should be seen as a social investment. Furthermore, it creates jobs where they are most needed. More doctors, nurses. These are now what we know are really essential workers. Next. I'll just make it quick because I'm running out of time. So when we know that social policies need to be financed, but let us also be mindful that we finance it in a way that is progressive. In other words, we protect lower income families from for example, increased taxes. We promote the bayanihan spirit so that those who can pay more should give more, no? The richest corporations and high net worth individuals. And let us prevent wasteful spending. Next, please. So very quickly, some reflections. We know that GDP growth is not enough. We need deliberate policies, other policies needed to eradicate poverty and to promote redistribution. We need to rebalance and shift our priorities to make sure that we're putting and investing more on well-being, on putting care at the center of development, and to reflect this in terms of our budgets. It is also so important to note na napakahalaga ng papel ng ating Estado, ng gobyerno, in the provision of public goods, especially goods that care for people and planet. While, of course, we welcome and we know that others actors, that non-state actors like the private sector and CSOs have an important role to play, they are not a substitute for the state. The state has to come in because they are mandated to do so and they have resources to do so. And that means that we need to strengthen the capacity of the state, both at the national and local level, to do what they need to do, both address their administrative capacities and their technical competence. Next, please. And so important, you know, politics is at the center of development. So strategies that reduce poverty and inequality and that tip the balance of power so that the rights and interests of the poor and socially excluded groups should be prioritized so that outcomes are more redistributive. Finally, we're almost there. Next one, please. Next. 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 Sorry. 2 more slides, I think. Anyway, I'll just say it. I actually wrote more about some of the issues I've raised. And so if you're interested to hear about it or to read about it, I can share this with you. Not much has changed in terms of the analysis and the trends The numbers may have changed, but I think the analysis remains valid. So I just like to end with some words from Arundhati Roy, who said that while the pandemics have forced us to break with the past, now is the opportunity to imagine a new world. No? We can choose to walk through this world, dragging our old prejudices and hatred, or we can walk through this world lightly, with little luggage and ready to imagine another world, and particularly ready to fight for the world that we want. So, Zach, I think I'll end there for now. Maraming salamat.
Thank you very much, Maribik, for that very comprehensive, first of all, reflection of where we are now, and also I think for your set of recommendations that really cover yung gamut ng kailangan talaga natin gawin from the social protection side all the way to the policies and education laws that we need to enact. And we actually have two questions, so if you allow me to read the questions, maybe I'll read the questions first and then you can respond in one before we go to our reactors. So the first question is from Jack Cantos from AER. Hi, Maribik, thanks for the presentation. Can you expound a bit on the concept of a national law on inclusive education? Is that more of access and the quality, and up to what level? The second question is from Jerwin Enerlan. Is there a need to increase the amount received by CCT recipients considering the increase in the cost of basic needs, especially in education and health? So yeah, those are the two questions.
Right. So, Jack, I think we should be asking this to our colleagues in the education cluster. But my understanding of the inclusive education law is really to strengthen, for example, alternative learning system, where a huge section of our children and youth are out of school. It also wants to highlight other socially excluded groups. Like I mentioned earlier, children with learners with disabilities, learners from the indigenous peoples, Muslim children. No? The budgets for this are quite limited. So when we talk about an inclusive law, it would really focus on those who have been left behind. And so that's basically what we're saying. Now, in terms of CCT, do I say therefore that we need to increase the CCT? Siguro very immediately that would make sense if we want to maintain the objectives of CCT as it currently stands. If we want to make sure that their levels of consumption are somehow preserved, then rather than eroded, if cost of living goes up, then we will have to peg, for example, the cash transfers to inflation, or index it to inflation so that their consumption levels are not sacrificed. But I think it's important to also see the big picture, because in a sense, among those who are in need and those who are excluded, in a way, CCT beneficiaries are more privileged. So what about others who are not beneficiaries? You know, the exclusion error of CCT, of Pantawid Pamilya, is quite big. The inclusion and exclusion errors of CCT is relatively big also. So I think I would, right now, if we want to be strategic about our resources, I would think that let us spend more time now making a strategic assessment of all social protection programs, see where are the gaps, which program makes much more sense because it has a bigger coverage and it will be more effective in the future. That analysis has never happened. And implemented in terms of the results. So I would like to spend more resources and time with that assessment-based national dialogue, and then support the recommendations arising from that, including actually strengthening, for example, and operationalizing the universal social protection floor, because ang laki din ng coverage niyan. It will cover immediately a lot of women. It will cover immediately a lot of children. It will immediately cover persons with disabilities, people who may be earning but not earning enough, no? So, senior citizens. Lahat yan kasi, itong mga socially excluded groups have been named in the Universal Social Protection Floor. So I would also look at that, no, and not be limited to CCT.
Okay. Thank you, Maribik. There's actually another question in the chat box, but I'm not sure if this is just for you. I think Carl mentioned this is for everyone to answer. So I think everyone can also answer this in the chat box. But the question is, and Maribek, let us know if you want to answer this or wait for others to answer first. Do you think that mass industrialization is still viable for us, in that it appears to have a large labor absorption capacity, unlike retail and the real estate industry? So I don't know why he mentions the real estate industry in particular, but yeah, yun yung tanong.
I can answer that because
Sure.
you know, one of the most sustainable pathway out of poverty is access to what we call decent work, characterized by jobs that are very productive, high productive jobs, high value jobs in the formal sector, because once they're in the formal sector, they can be regulated and they have access to social security. So in a sense, labor productivity, jobs with with people with access to these jobs, studies show this means that you are able to improve a country's standard of living. The more people have access to these jobs, their standard of living goes up. So high value jobs are found, for example, in the manufacturing sector. The highest productivity jobs are in the manufacturing sector. Of course, high value jobs can also be found in the service sector. And if you modernize agriculture, there can be some of that. But inherently, the manufacturing sector, because of the technological requirements and all that, mataas talaga. No? So it's very important to agro-industrialize. I would push for agro-industrialization, but in a manner that is in a way that is sensitive to climate change. We can no longer industrialize in the old ways because of the reality of climate change. So it's also more challenging for us, but I think it is a necessity. We will not really be able to modernize. We will not be able to get out of poverty and inequality for as long as our people are in low income, low productive, low wage, informal jobs. So industrial policy is so important.
Okay, thank you very much, Maribek. And again, thank you for your presentation. We'll now move on to our two reactors who, of course, now will not only react, but really challenge us to think about how to apply what Men and Maribek have shared in very practical terms. So allow me to introduce our first reactor. She is Daryl Layesa, is a member of the Pambansang Coalition ng Kababaihan sa Kanayunan, or PKKK, a coalition of small farmers, fishers, indigenous women, informal workers, and women's rights advocates from 32 provinces. PKKK unites on a rural women agenda that has evolved since the first Rural Women Congress in 2003, in which Daryl was one of the lead conveners. Currently, Daryl is the project coordinator for PKKK's Sexual Health and Empowerment Advocacy and a member of the National Gender and Development Resource Pool of the Philippine Commission on Women. She earned her bachelor and master's degrees in public administration from the University of the Philippines and a postgraduate diploma on governance at the Institute of Social Studies in The Hague. So let's all welcome Daryl.
Thank you, Zach, for that introduction, and thank you, Oxfam, for inviting us here to provide the rural women's perspective. First, let me take off from the last slide of Marivik, which basically implies that as we usher into the new world, we must choose what to bring and what not to bring. So I love Arundhati Roy, but I love Marivik Raquisa more because she's a dear friend, and then she seemed to have already packed a good selection for us. My role now is to comment further on what to add into that language and perhaps what to leave behind as well. The two presenters were very helpful in this reflection session. They explained their positions well, na ipaliwanag at may nakita akong liwanag, pero may nakita rin akong dilim, may nakita akong better, may nakita rin po akong bitter. So I will try to react on those points, and I will be framing my reaction with Sarah Longway's Women's Empowerment Framework, which basically looks at the levels of empowerment in 5 major aspects: welfare, access, conscientization, participation, and control. In the process, I hope to bring the voice of the rural women leaders of PKKK, who in the past 2 days had a good discussion about the current situation and what they really hope for to be the reality in the immediate future. So that will be my guide, my framework. But let us visualize these 5 levels of empowerment with our hands. So let's use our hand as our visual tool. First is our little finger, or yung hinliliit, to represent our welfare concerns. We have a saying here in the Philippines that what pains The little part of our body can pain the entire body. Ano po, yung ang sakit ng kalingkingan, sakit ng buong katawan. The same can be said for all things that seem to be basic but disregarded in so many ways. What am I saying? Food, shelter, health, income, jobs. During this pandemic, response has been focused on health and prevention of infection. But social scientists have already conducted surveys saying that the people are more afraid of starving, no, than getting infected. As our farmer leader from Davao Oriental, Nanay Conchita Masin, said during our conversation, I'm 72 years old. Don't tell me not to go out and sell my produce, sell my vegetables. It's my right to feed my family. This only shows how lacking the response was to people's basic rights to survive. She didn't receive any SAP or the Social Amelioration Program fund because her husband is already receiving pension of 3,000 pesos, but which is not enough for his medicines alone, na hospital pa. So the barriers to rural women to improve their income and livelihood have much to do with the second finger. The ring finger, no? It represents access. What resources do we need in these trying times? Marivic emphasized social protection because, again, it's not just about surviving, but also surviving with dignity. Unfortunately, the MACWI or the Magna Carta of our workers in the informal economy has not been pushed until now. It could have helped guide with the targeting of beneficiaries in this time of pandemic, or as Marivic mentioned, the social protection floor. And speaking of beneficiaries, much has been said about the ayuda, no? The inclusion and exclusion issues, which are also not new because these are also issues with the Pantawid Pamilya program. But again, that's the assurance that we hear oftentimes about the ayuda, about the social protection. There is the 4 Ps. There is the Pantawid Pamilya already. They are already beneficiaries of the conditional cash transfer. But says who? One of our leaders, Bae Edwinda Sarmiento, she's a Manobo leader from Wao, Lanao del Sur. She said that for the past 2 years, they have been waiting for the cash grant. They are members of the MCCT, or the Modified Conditional Cash Transfer, being indigenous peoples. They have been waiting for 2 years, but since they have been listed for 2 years as well, so they have not received it yet. But since they are listed, they did not receive the SAP. So that's one clear exclusion that we do not hear from here in the urban centers, pero nandoon. It doesn't mean that they're not bringing these issues to the proper authorities because they're reporting to the SWT. But then these do not come into our mainstream conversation when we talk about ayuda or the SAP. But life goes on, of course. They should be self-sufficient nonetheless. They are farmers, they are peasants, they have indigenous crops, they have indigenous seeds. But for the past months, during the pandemic, the early part of the ECQ, they have to consume their harvest. What's supposed to be allotted for planting, they have to consume it for their own food. So in the end, they need to have access, again, access to seeds. But did they receive these seeds? No, they were not able to do so. They have to take out loans again from the traders. Come harvesting time, they need to have access to market. But yesterday they were saying no one is buying their corn. So without income, without access to income, they cannot access other life-saving services as well, essentially health. Imagine also that in these areas, in these geographically isolated, disadvantaged areas, transportation is classified as one of those life-saving services. How can they bring people to the service providers, the health centers, if they have no 500 pesos for hiring motorcycles? Yung habal-habal. So the same logic also applies for sustaining education. How they can sustain the education of their children if they don't have enough income, no? That they can spend on these important services as well. So these are issues that we need to raise our awareness on, and which bring us to the third level. So we have the welfare, we have the access issue. We need to look at raising awareness about these issues, and this looks at conscientization. In terms of representation, I would like to say that this middle finger, it powers everyone. And for me, it symbolizes the other levels, overlooking the other levels of empowerment. For us to usher into the better normal, we need to have a more critical understanding of things. Both speakers mentioned about the transformative, and we have to challenge ourselves by what we mean by this transformative. Good also that both of them mentioned that despite the improvement of the GDP and the poverty incidence, there's no drastic transformation in terms of social inequities. My 2 cents here is to look at what we need to transform, even if we do not see or hear it. We need to look at what's not visible and listen to the silence. We had a good example when Marivic mentioned about care work, because now we're making it more visible, the reproductive aspect of work. Oxfam, I know, participated in the Rapid Gender Analysis, RGA, of which PKKK was also involved in collating the data. There, we were able to make visible how unpaid care work increased during this pandemic. If before pandemic, women are working 6 hours more than the men in a day doing care work, it even increased. But the good news is there's evidence of shared care work between men and women now. But the idea is when we recognize this, only when we recognize this can we now act and say, let's reduce and redistribute care work. Let's represent care work in all discussions. So for me, this is a good conscientization exercise. No? Imagine if we can do the same to the silent issues. What are the silent issues? Like what? Like women dying of unsafe abortion every day. We want to talk about life-saving strategies, then let's talk about the causes of death. In 2012, data gathered showed 600,000 women and girls died of unsafe abortion. I'm being teary-eyed about this data. No? What does it mean? 3 women dying every day, 11 women hospitalized every hour, 70 women inducing abortion every hour. And why did they have to access abortion anyway? The same data set showed that 75% is due to poverty, 40% due to young age, 13% due to gender-based violence. We must be alarmed by the silent pandemic of gender-based violence. Rape cases increased. In PKKK areas alone, we had 8 cases of incest rape. And these are repeated rape that were exposed during the COVID lockdown conditions because, of course, it's locked down. So those who perpetrated the rape were easily caught. And these are life-saving issues that we need to challenge and we need to transform. Because this would require transforming the structural causes of poverty and patriarchy. That was very emotional for me. Okay, so that's conscientization. Fourth, our index finger, our hintotoro, hintotoro, representing participation. It is our pointer, right? And now we're talking about the direction of the better normal. Shouldn't we be involved in pointing where to go? I support the statement that there should be increased representation of CSOs in the decision-making processes, particularly in the IATF. But let me emphasize also that we should ensure equal gender representation as guaranteed by the Magna Carta of Women. We have read from news and even maybe from social media that the countries responding well to COVID have women leaders. But here, the current situation seems to be threatened by strong women leaders. Also, participation in a better normal begs the question, do we really need to bring in the terror law? Do we need to bring in red tagging and extrajudicial killings? So these are questions, no? In the light of participation. But let me cite some good examples also. Yesterday, PHILSSA Castro, our women leader from Salcedo, Eastern Samar, said that they were able to participate and contribute substantially in the food security planning workshop at the municipal level. We should pursue this. We should institutionalize this. For rural women who are often excluded in the registry system and list of farmers and fishers, we need to assert our participation in the local governance spaces. Fifth, last is our thumb. It represents control. For me, it represents control. Thumbs up if we agree, sabi sa Zoom. Thumbs up if we like, sabi sa Facebook. No, because even if we have access to welfare services and social protection, even if we are able to voice out our opinions, but in the end, we find ourselves not having any control of these gains, then nothing has been transformed. It is like many things happened, but nothing changed. We would have participated well and good in the food security. We could have participated well and good in the food security planning and workshop, only to find out later that macroeconomic policies such as rice tariffication law removes that control over food security, or more specifically, over our food sovereignty. Earlier, Men mentioned that pre-pandemic time, the rice tariffication law was one of the transformative reforms. And for us, this is the problem. The rural sector, the small farmers have been shouting their lungs out that the law did more harm with the flooding of imported rice, and practically it tortured the farmers with the low farm gate prices. It's torture, not even able to recover the production cost of 12 pesos per kilo, then being faced by 9 pesos selling price minus the 2 pesos per kilo transport cost. You have only 7 pesos per kilo. This is the case of the indigenous women in Ampatuan, Maguindanao. In aggregate, RTL has resulted to 80 billion loss for the small farms, for the sector. Data showed that, yes, there's a decrease in the wholesale price of rice, but this did not translate to the retail price. So in short, our consumers are also not benefiting from it. Our rural women fear that the same scenario will happen this pandemic. We have to establish its link with the neoliberal policies entrenched until now. So I guess my question is, when Men said that we are seeing the failure of the neoliberal policies, does that mean we start with repealing the rice liberalization law, or ensuring the small farmers or small sectors have better safeguard measures? It was mentioned as well that we need to differentiate the tools and principles, and I have to say we cannot separate the two. It's like just any action needs to be guided by theory. Our tool should be able to give control to the people, and that tool should subscribe to the food sovereignty principle. And sadly, rice liberalization is failing to do so. So that's my reaction. I have run out of fingers. So we need to be guided by these principles, and I hope that we continue with this reflection. Thank you very much.
Thank you, Daryl. Akala ko may isa pang kamay na gagamitin mo. Maraming salamat, Daryl. And really good points and questions that I will give time to Men and Marvic to respond to later. But let's go on to our next reactor. Benedict Valderrama, or Dick Valderrama, is the National Coordinator of Partnerships of Philippine Support Service Agencies, or PHILSSA, a national network of NGOs working on inclusive, transformative, and sustainable urbanization. Dick is a longtime social development worker with experience in community organizing and development, coalition building, participatory research and advocacy, community-based natural resource management, disaster risk reduction and climate change adaptation, sustainable livelihoods and housing and urban development. So, ang dami, no? Dick also works with local people's organizations, especially with the Urban Poor Alliance and Aksyon sa Kahandaan sa Kalamidad at Klima, o AKMA, on organizational development, issue advocacy, and community resilience. So please all welcome Dick Valderrama. Dick.
Sige, magandang tanghali sa lahat. Sige. Yung reflections ko ay parang paano natin ibababa sa komunidad yung mga nakita sa macroeconomics at saka sa social systems natin. Sige. Sige. Yan. Sige, para maibaba sa level ng komunidad, tingnan natin yung isang pag-aaral ng epekto ng COVID-19 pandemic sa mga komunidad na ginawa ng UNDP at saka ng Zero Extreme Poverty Movement nitong May 2020. So nakita nito ay ilan sa mga key findings nito ay unang-una, yung malaki yung composition ng ating urban poor communities ay 70% nito ay halos mababa sa poverty line, 25% ay medyo middle income pero hovering sa poverty line. Tapos malaking sector ay nasa informal sector. Tapos yung epekto ng pandemic ay malaking bahagi ay 83% ay nakaranas ng pagbaba ng kita. At mahigit tatlong bahagi ay 1/3 ay totally lost their source of income. At kinailangan bilang tugon dito ay may mga pamilyang nag-skip na ng pagkain para makatugon sa pagkawala ng kita o pagbaba ng kita. Marami sa mga bilang tugon din dito, marami ay nakatanggap ng tulong. Marami ay galing sa so 84% ay nakatanggap ng pagkain at mga in-kind assistance mula sa gobyerno at sa iba pang mga grupo gaya ng mga CSOs, mga kaibigan at mga kamag-anak. Pero isang nakita rin, halos kalahati lamang ang nakatanggap ng cash assistance mula sa gobyerno. At karaniwan sa mga coping strategies na ginawa ng mga pamilya sa mga urban poor communities, ang paghanap ng iba pang mapapagkitaan, paghanap ng mas murang pagkain at pag-utang sa kanila. So, kumbaga, nakita dito na parang nilalagyan ng muka, ano nga ba yung epekto ng yung sinasabi ni Men na uncertainty at mga economic shocks at yung sinasabi ni Marivic na usapin sa social protection at social services, ay nakikita natin na malaki ang tama sa mga urban poor communities. So sa iba't ibang mga pagtulong. Pero yung isang nakita rin dito ay kumbaga na-highlight yung usapin ng security, safety at livability ng mga komunidad. So in the past years nakikita natin na almost meron tayo mga 2 million na housing backlog sa buong bansa at susubukan itong matugunan ng gobyerno sa pamamagitan ng mga programang pabahay na halos pare-pareho rin naman parang every year. Pero nakikita ngayon, lalong-lalo na sa issue ng pandemic, ng issue ng pabahay ay hindi lamang problema na masakit sa ulo. Ito ay dumating na sa punto na nakakaapekto na ito sa kalusugan at nakamamatay na ito. So kumbaga, yung problema ng pabahay na dating parang hindi masyadong nabibigyan ng pansin sa mga programa ng gobyerno, halos wala pang 1% ng budget ng ating pamahalaan ang nakalaan para sa usapin ng pabahay. Hindi ito nabibigyan ng pansin, pero dito sa pandemic ay kailangan natin itong bigyan ng pansin. Paano nga ba tayo magso-social distancing sa isang bahay na limitado ang espasyo? Paano nga ba tayo magkakaroon ng frequent at regular hand washing kung walang tubig sa ating mga bahay? So kasama sa mga issues ng pabahay, yung tenurial security, public safety. So maraming bahay ay nasa mga lugar na mapanganib sa ilalim ng tulay, sa malapit sa tambakan at iba pang mga lugar. Yung issue ng dissenting bahay na may maayos na espasyo at maayos na mga materyales sa paggawa nito. Usapin ng mga community services at facilities, lalong-lalo na sa usapin ng wash, transportation at communication, At paano nga ba sinasagawa ang pagpaplano ng mga pabahay na ito? So, yung issue ng pandemic ay kasama sa malaking tama sa mga urban poor ay yung pag-highlight ng usapin ng security, safety at livability. Pero kasabay din nito ay alam din natin na yung issue ng pabahay ay intimately linked sa issue ng kabuhayan. So yung pangangailangan ng sustainable at resilient livelihoods, nakita natin ang precarity ng informal livelihoods. 2/3 ng mga komunidad ay halos na sa informal sector at nakita na halos mahigit 1/3 ng completely nawala ng kinabubuhay at mahigit 80% ay apektado yung kabuhayan. So malaki yung ugnayan ng pabahay at ng urban communities sa usapin ng kabuhayan. Kaya rin yung kalimitang programa ng gobyerno na massive distant relocation ng mga urban poor ay hindi nag-work yan dahil pagdating doon sa area, walang mga serbisyo, walang kabuhayan, kaya napipilitan ang marami na bumalik sa kalungsuran. So kasama rin dito yung issue ng food security. Sa urban communities ay halos lahat ay binabayaran natin, tubig, pagkain, gulay. Yung usapin ng kung apektado ang income ay apektado rin ang pagkain. Kaya importante na tingnan yung usapin ng food security kaugnay ng usapin ng sustainable at resilient livelihoods. Tapos, kailangan mag-diversify, mag-stabilize ng mga income sources at income stream dahil in the end, yung usapin ng pabahay at mga urban poor communities ay usapin ng kabuhayan din ito. Siguro mahalaga ring banggitin na isa sa mga programang naging tugon ay yung tinatawag na Balik Probinsya program na nakitang hindi naging epektibo dahil hindi naman dinaan talaga sa konsultasyon sa mga tao dahil yung mga skill set at ng mga nasa urban communities kung ilagay mo sa rural communities ay hindi rin mag-fit ang mga ito. At sa maraming kaso, nakadagdag lang ito sa parang transmission ng COVID sa maraming lugar, ng lugar na dati maliit o mababa ang kaso, pero dahil sa Balik Probinsya program ay biglang nagkaroon ng spike o surge sa kalagayan sa maraming probinsya. Tapos, kaugnay din ng pabahay at kabuhayan ay yung usapin ng social services at social protection. So marami nang nasabi dito si Marivic sa usapin ng health, education, community care at protection. At in the end, lahat ito ay patungkol sa human dignity at well-being. Pero siguro gusto ko lang banggitin dito na itong linggo lang na ito, nabasa ko sa isang dyaryo na yung cases ng rape ay malaki ang tinaas nitong panahon ng community quarantine to the point na halos every 18 minutes ay may rape na nagaganap. At ito ay mga kaso na reported. Kung iisipin natin na ang reported na cases ay maliit lamang na bahagi ng kabuuang totalidad ng protection issues at ng gender-based violence, makikita na malaking problema kasabay ng pagtugon sa usapin ng pabahay at kabuhayan ay yung maayos na buhay sa pamamagitan ng community care, community protection, at pagtugon sa issue ng dignidad at maayos na pamumuhay para sa mga tao. So kung titingnan natin, kasama sa tama ng pandemic at ng community quarantine sa mga urban poor communities ay so malaki at malalim ang tama. So ano ba yung mga pwede nating gawin dito? Unang-una ay kailangan mag-intensify, mag-innovate ng community organizing, solidarity at empowerment. Even if dito sa kalusuran, sinasabi natin na madali ang access ng maraming mga bagay, pero kung titingnan din natin yung issue ng anonymity at ng kawalan ng interaction ng maraming mga tao ay malaki ang porsyento ng maralitang tagalusod ay largely unorganized. Unang-una, walang panahon para sa mga usapin ng organisasyon, pero nakitang importante rin ang mga organisasyon sa pagkuha ng ayuda, maging sa pamahalaan man yan o sa pribadong sektor o sa mga NGOs. Malaki ang papel ng mga samahan para maka-access ng maraming serbisyo at maraming mga programa para sa kapakanan ng mga pamilya at ng mga komunidad. Tapos yung kasama rin sa issue ng organizing at empowerment ay yung issue rin ng paano nga ba nag-uugnayan ang mga organisadong mga grupo. Masasabi nga natin na minsan ay maliit na nga ang porsyento ng organisado, hindi pa nagkakasundo-sundo at hindi nagko-compete pa yung maraming mga organisadong grupo ng mga maralitang tagalusod. So kasama sa usapin ng pag-oorganisa ay usapin ng solidarity at usapin ng empowerment na paano nga ba natin ito isasagawa sa panahon ng pandemya at panahon ng quarantine na limitado ang pagkilos. So kailangan nating mag-innovate at paano nga ba natin isasagawa ang mga ito. Nakita natin dahil sa tama ng pandemya at ng community quarantine, kailangan ng pag-oorganisa. Pero paano nga ba isasagawa ito na limitado ang mobility, limitado ang pagsasama-sama ng mga tao. So kailangan nating tingnan, pag-aralan at sumubok ng mga pamamaraan kung paano natin i-intensify at i-innovate ang pag-oorganisa at pagsasakapangyarihan sa mga maralitang komunidad. Pangalawa ay yung pag-integrate at pag-innovate ng delivery ng social at economic services. So, paano nga ba natin ngayong na-highlight yung issue ng social housing, paano nga ba nating mas lalong ipupush ang social housing para sa mga maralitang tagalusod para mas magkaroon ng mas maraming espasyo para matugunan ang mga health risk at hazards ng pandemya. Paano rin nga ba matutugunan ng usapin ng kabuhayan, lalong-lalo na para sa mga nasa informal na sektor, paano nga ba natin gagawing sustainable at resilient ang kabuhayan ng maraming pamilya at ng mga komunidad. Pati na rin ang issue ng protection, paano nga ba natin to mas at ng social services, paano rin natin to mas lalong mapapaigting sa ating mga komunidad kasabay ng pagtugon ng mga problema sa pabahay at kabuhayan. At malaking area dito yung kahalagahan ng natawag nating localization. Paano nga ba nating inuugnay ang mga lokal na mga sektor at mga lokal na grupo sa pagtugon ng maraming problema natin. Kanina sa presentation ni Men at sa presentation din ni Marivic, na tinignan ang mga economic at mga social policies natin. Pero tatagos lang ito sa mga komunidad kung merong mga lokal na grupo na kayang magtulak ng ganitong mga reforma sa antas ng mga komunidad, sa antas ng mga pamilya na nangangailangan ng ganitong social at economic services. At panghuli, kailangan din nating makapag-explore, makapag-subok ng mga bagong pamamaraan ng advocacy at engagement, lalong-lalo na sa level ng lokal na pamahalaan, given na malaki ang problema sa pag-engage sa national government, pati na rin sa ibang mga sektor, pribadong sektor, para pwedeng mapagtulong-tulungan ng konkreto ang mga komplikadong problema sa babahay, sa kabuhayan at sa serbisyong panlipunan para sa mga komunidad na nangangailangan nito. So yun siguro. So community organizing, localization ng mga social at economic services, tapos bagong forma ng advocacy at engagement para maisulong ang mga ganitong mga polisiya at ganitong mga programa para sa mga maralitang pamilya at maralitang komunidad. Salamat.
Maraming salamat, Dick, and of course kay Daryl. I think yung key takeaways ko sa reactions po nyo ay we need to make sure that even in spite of this social distancing, physical distancing, the need for compliance and obeying the rules and guidelines, we have to make sure that we're listening to the voices ng communities na sa baba, kasi alam natin that they are the ones who are disconnected, no? Usapan natin kanina yung digital divide, and they cannot necessarily advocate directly to the national government or even the local government. So baka key role ito and key challenge, sabi nga ni Dick kanina, we need to understand, suriin natin how can we as civil society be the stronger voices for these communities on the ground and of course advocate for them. So let's go back to our main speakers. I know they have a lot to say as well dun sa mga reactions nyo, and then of course we'll wrap it up. So thank you very much to everyone for staying on. We'll be ending in a few minutes, but we want to hear our main speakers, no? So Men, baka you want to start off your own reactions?
Hello?
Yes, go ahead, Men.
Ako ba, Sak? Okay, thank you. Napansin ko yung ilang questions at yung discussion ay patungkol din doon sa rice tarification. At baka ito rin yung parang ko para mapagsanib ko yung inputs ni Daryl at saka ni Dick. Daryl na siyang kumakatawan din sa ating mga magsasaka. Si Dick naman, nakapagpalawig naman siya sa mga pananaw, sentimento ng urban poor. Ngayon, let's return to rice tarification dahil ito yung isang concern din ni Daryl. Simulan ko muna sa isang kwento. Yung AER may mga volunteers mula sa UP School of Economics at tinanong ko sila, kasama dito yung isang pamangkin ko, so far, ano natutunan nyo sa economics nyo? Ganon. At yung sagot ng pamangkin ko, yung the concept of a trade-off. Ganon. That concept of a trade-off is a core idea in economics. Actually, hindi lang sa economics, kundi sa public policy in general. Laging may trade-off. Kahit sa buhay natin, laging may trade-off. Ganon. So we have to recognize the trade-off. At kahit sa rice policy, may ganun trade-off. I can understand where farmers are coming from dahil apektado nga sila noong rice tarification. But we have to recognize that there is a trade-off, and from the trade-off, we try to develop a policy that will attempt to alleviate the situation of the most affected. Ganon. But we cannot avoid the trade-off. Ganon talaga yon. In the end, we have to look at the bigger benefits for society of a particular policy. So tingnan natin yung sa rice. I hope you are not saying that we return to QR or quantitative restriction because it really failed. Ilang dekada yan, hindi naman nag-improve yung sitwasyon ng ating mga magsasaka. So we cannot return to that old regime. So the question is, what is the new regime? So here it is, a QR. Of course, it has an effect in the short term on farmers, but we are hoping that for the longer term, it will benefit not only our consumers, but the farmers or producers as well by increasing yung productivity nila, by increasing their income when we introduce the reforms. Ang problema kasi doon sa protection, doon sa trade protection, we became complacent. Yan ang problema sa protection eh. Nagiging complacent tayo to put in place the reforms. Kaya walang reforms na naganap. Ngayon, meron ding cost sa buong lipunan at mas malaki ang cost sa buong lipunan ng tinatawag na quantitative restriction. Halimbawa, totoo, binigyan natin ng proteksyon yung ating mga magsasaka. It should have been for a limited period. The whole idea there is, okay, create a space, create a temporary period for our farmers to undertake the necessary changes in productivity, in technique, in innovation, para makabangon at para maging competitive. Pero naging perpetual eh. Hindi pwede yun naman yung ganon. Meron ding trade, may cost din kasi yun sa buong society. Alam na natin, yung isang cost niyan ay sa pagtaas ng presyo ng bilihin. Established na ang isang principal predictor of inflation ay food prices. Sa food price naman, bigas yan. Lalo-lalo na sa urban poor. Ang urban poor, kung gusto rin natin protektahan ng urban poor, we have to make yung prices are affordable, especially food. Merong correlation, merong association ang pagtaas ng presyo ng bigas at ang hunger and saka poverty incidence. So marami tayong mga mamamayan because of that QR ay naapektuhan ng pagtaas ng presyo. Isa pang naging trade-off dyan, dahil binigyan natin ng proteksyon ang mga magsasaka, kailangan magbigay din ng merong katumbas yan. Dahil doon sa rules na mamagitan kaugnay ng world trade, yung ating livestock sector naapektuhan. Bumukas ang livestock sector natin, naapektuhan din yung mga farmers, producers sa livestock. So yun ang naging problem sa trade. Yan ang problem ng trade-off. Paano ngayon natin susubukang bawiin yon dahil may cost nga sa magsasaka? So diyan pumapasok yung iba't ibang interventions. In other words, we are changing the policy that will still protect farmers. Sa halip na trade protection, sa halip na yung quantitative restriction, ang magiging support ngayon, and we are still in that early stage, ang importante, gusto nating mag-work ito through subsidies. Bigyan natin ng support ang mga magsasaka, kaya cash transfers, loans, and the like. Ganoon. Ang hope natin, makakatulong ito para mag-improve yung welfare nila. So, yun tapos hindi rin totoo, it's a misnomer to consider rice tariffication as neoliberal. You know why? Neoliberalism, as I said, is about ideology, about a belief in the free market. But rice tariffication is not really free market eh. Ang free market, zero tariff or low tariff. Itong rice tariffication nga, 35% yung tariff eh. So there is still a level of protection for our rice producers. So it's not neoliberalism in that way. In fact, kung titingnan yung accompanying policies, there will be subsidies by government, which again, neoliberalism discourages. So, yun ang magiging paliwanag ko. I can understand the effect and I can sympathize with the farmers, but the way to go forward is to how to support farmers, but not in the old way, which has proven to be a failure. Salamat.
Okay, thank you, Men. Before siguro we go to Marivic, baka Daryl may response ka ng konti.
Maraming salamat, Zach. Maraming salamat, Men, for that clarification. Siyempre, parang nagugulat din ako to hear that it's a misnomer, no, na hindi siya neoliberal policies yung rice tariffication, knowing too well yung history na tayo naman din, inaral natin yan noon pa, na it's part of the WTO agreement, the push to lift the QRs and really to liberalize the sector. So for me, it's not a misnomer na tingnan natin siya sa framework ng neoliberal. And we're even using trade-offs sa lengguwahe natin ngayon, which is also subscribing to the capitalist principle, no, na may kapalit. So may kailangan tayong pagtiisan. Pagtiis tayo bumaluktot habang maiksi ang kumot. But at the same time, gusto ko lang din i-share na yung for the longest time, hindi yung protection yung naging complacent tayo eh. For the longest time, yung suporta sa mga magsasaka ang wala. No? Even if may QRs, pero kung wala naman yung subsidies, wala yung enough na support para tulungan sila, even if we had the agrarian reform pero walang support services, then it would be really difficult na saluhin kung ano man itong sinasabi nating trade-off. Yun yung isang nakikita ko. Pero maganda na may ganito tayong diskusyon. Kasi, again, babalikan ko yung sinabi ni Zach, we really need to listen to the voices of the people. At ang hirap sabihin, ang hirap i-invalidate yung sinasabi nila eh. Na hindi naka-apekto ito, na in the future, kaganda ang buhay. And even the consumers, at sila rin po, the producers are also consumers. Imagine, wala silang kinita, pero bumibili rin sila ng bigas. And they're not feeling the benefit of it. Kasi nga sabi ko po kanina, hindi naman drastically bumaba ang presyo ng bigas sa ating merkado. So ganun din sa rural areas. So I guess maganda na pagpatuloy ay mayroong another forum for this, I think, sa 17. So dun sa mga interesado pang tingnan at balansihin ang iba't ibang perspective on this. We're pushing for people, sabi nga natin, baguhin natin ang framework. So tingnan natin, people-oriented development. Yun yung aking makikita.
Maraming salamat.
Dahil gusto ko lang iklaro, no? Concepts lang. Pero okay yung idea na magkaroon ng another forum on rice tarification. Iklaro ko lang, no? The concept of trade-off is not limited to economics. Every day, may trade-off tayo. Right now, we are discussing in a webinar, may trade-off yan. Pero halimbawa, ang ginagawa ko ngayon, may kausap akong iba regarding a certain policy that we want to establish. So it's there in everyday life, and we have to recognize that there are trade-offs in life. And secondly, it's not about WTO for me, and that's why I don't consider. Kaya wala ako sa framework ng neoliberalism. Ang framework ko, ano ang makakatulong sa taong bayan, including the farmers. And I'm saying there are other ways to support the farmers without sacrificing the welfare of the majority of the people. Yun ang gusto kong i-explore. Ang explore natin kung saan makikinabang ang lahat, even as we recognize na mayroong mga temporary adjustments that have to be done. At sa ngayon talaga, nasa isang period of transition pa tayo. So it still has to be established later kung talagang magiging matagumpay itong reformang to. But yes, it's a subject for further discussion in the future.
So maganda nga, part 2.
Just short
sorry,
lang.
Daryl.
Kasi sinabi na din ni Mel, no, na meron tayong dapat hindi i-trade off pala. At the end of the day, meron tayong hindi dapat i-sacrifice. And yes, we have trade-offs every day. Yung right mo to self-determination, minsan nade-trade off nga eh. Diba? So, pero pwede bang hindi? Pwede bang mangyaring hindi ito ma-trade off? Kasi yun yung meron kayo. Yun yung karapatan natin as a people.
Okay, maraming salamat, Mel and Daryl. That was a very good exchange. Please, for the others, comment ka na lang kung where do you stand on this issue. But let's go to Marivic. Marivic, I think you have a few words also you want to say, and then we'll wrap it all up with Lot.
Yeah, just two things. Thanks for that extremely productive and wonderful exchange and inputs of the past speakers. Just 2 points. I just like to thank Dick for his input, but I also want to kind of problematize one of the things he said, which was the localization of services. And the reason I say that is because if we look at the evidence, we try to localize health. And evidence shows that we have health services has deteriorated for poor Filipinos when health services was devolved. And we need to understand why that happened so that it may not happen to other services. And there's a lot of, and maybe we can have another forum on this too. But one of the compelling reasons kasi kung bakit nag-deteriorate ang health services nang nag-localize ay una, hindi handa ang local, ang LGU, to absorb these new services. And two, hindi nila naging priority ang health services. Kasi competing priorities yan eh. And a lot of the times, nasa mababa ang naging priority for health, among other things, no? So kailangan natin pag-aralan, no? And then second, you know, there are studies that show under what conditions does localization work to reduce poverty and inequality. One, if you have a developmental and modern local elite or bureaucracy. So how developmental are your local leaders? How modernizing are they? Because if backward or if warlord or, you know, ang LGUs natin, we need to think about that. Number two, I know we have islands of good governance, but iilan lang yan eh. Karamihan ba, ano ang status ng LGU leaders natin? So we need to think about that. And number two, we need an active citizenry. You know, the experience of the local government code shows that even if we have institutionalized CSO and PO participation in local government bodies, it has hardly worked. And again, we need to understand bakit ganun ang nangyari. And again, studies will show political economy in the local area. Either weak or absent ang mga CSOs and POs at social movements at napakalakas ng political power ng mga traditional political elites. So again, we need to problematize that. I'm not saying that it's wrong. We should. I like the idea of, you know, localizing, but let's also come to grips with what the realities are so that we can do it better. And then just a quick comment on the exchange between Men and Daryl. I think that there is a consensus that we really want to make life better for farmers. But I think isang starting point kasi is that how do we do agricultural policy right? No? It's true that in the past, for example, yung sinabi nga ni Daryl, kulang naman talaga ng suporta sa farmers, and B, yung QR did not work. One, it was not time-bound, and two, there was no performance criteria. And you know, government is learning from this. DTI now wants to do industrial policy that is time-bound, that has a performance criteria. In other words, it's not as if it can't be done. So we don't, my point is, what is our starting point? Do we assume that QRs are always a failure? It will, as Men was saying, it will depend on the tools and how the tools are used. Tools in the hands of good or bad leaders, you know, can be used any which way. So I think that we need to have a conversation about these tools and these starting points. But if we agree that the starting point isn't really about trade-off, it's about improving the quality of life of our farmers, then I think the trajectory of this conversation will take a different turn. Yun lang po.
Salamat, Maribek. Baka si Dick may gusto pong sabihin. Last words?
Sige. Agree naman ako dun sa sinabi ni Marivic na kailangan tingnan yung i-balance natin ito. Pero nakikita ko rin na kailangan yung paano natin may improve ang local participation ng mga local stakeholders sa paghubog ng mga polisiya at ng mga programa para sa mga komunidad. So I think it should be a balance of pero hindi naman natin pwedeng parang hayaan na manggaling lamang sa itaas ang pagbabago ng mga polisiya at programa. Kailangan I think dialogical naman ito na may mahalagang papel ang national institutions, pero malaki rin ang papel ng mga local stakeholders at local sectors in developing really effective and really responsive policies and programs for communities.
Salamat, Dick. Okay. I'd like to call on si Lot Felisco of Oxfam to say her own reactions to our speakers today and wrap it all up.
Salamat, Zach. Hindi na siguro ako magdadagdag ng my own reactions, pero pasasalamat na lang kasi I think we had a very deep discussion at partly dahil may mga bagay na hindi tayo lahat nagkakasundo, which is a good sign. I think we need to bring different perspectives to the table, and that might mean having some disagreements on certain issues, but at least we are talking about them and committing to a further discussion. I think tama lamang yon. Nakita ko rin sa chat box maraming mga lumalabas na ideya about what else can be done. So I think taking those two together, I think we've had a really good discussion and met what we wanted to achieve with this webinar, which was to raise issues for each other, but also for ourselves as we go back to our organizations. And that's what I hope we would do. We go back with those thoughts and we either tackle them within our own organizations or with each other as Dikas enjoined na kailangan nag-uusap-usap tayo on a sustained basis dahil kailangan nagkakaisa tayo sa panahon na ito. So I'm really thankful kasi we went through such a brief, condensed refresher, I would say, no, starting from men on economic policy, and Marivic's input was so helpful in terms of really giving us an overview on the social policy and social protection issues that we should be looking at, to Daryl's very heartfelt and very insightful, very strong reflections on what are the other aspects we should be looking at, nabanggit ng silent pandemic, and Dick on always prodding us to think of what does this mean for communities on the ground. So for that, I'm truly thankful. We took a very good and very reflective tenor, I think, with the discussion, starting off with what men said na ito na nga ang last nail on the lid of the coffin of neoliberalism. Totoo kaya yan? Or is this a passing phase again? Kasi, di ba men, we've been through so many cycles na of policy work that sometimes we have to think to ourselves, ano kaya talaga, what will really push this? But that is already reflective of what we are in at this stage. Also, Marivic, yung soul-searching mood ni Marivic, no, when she opened her discussion with that soul-searching, really, I think, brings us into another direction. And thank you, Marivic, for using that quote from Arundhati Roy that we've really seen at this time. Kasi this can be a transformative moment, is I think what speakers are also saying. But it's really up to us in a way. Paano natin ma-seize yung opportunities, paano natin ma-analyze yung opportunities, paano natin ibalik, bring back to the table yung usapin ng dignity, well-being, solidarity, empowerment, and even what Dick keeps reminding us of, organizing. Kasi whatever we discuss at this sa ganitong level ng mga usapan, it really has to redound to the well-being of people and communities who need these changes the most. So I would really just like to say thank you to our speakers and our reactors for such a rich discussion. Thank you, Zach, for guiding us through the last few hours, and thank you to everyone who stayed and who watched on our live stream. Thank you so much. Hanggang sa muli, ituloy pa natin yung usapan na ito. Maraming salamat.
Thank you.
Maraming salamat lot. Thank you very much, and thank you to everyone. Have a good lunch po and a good weekend sa lahat. Stay safe and stay healthy.
Thank you.
Salamat.